Okay, good morning and good afternoon, everyone. I welcome to our 28th MedResults Network educational webinar. I'm Jamie Parrott, the COO of MedResults Network, and it's kind of crazy that we've done almost 30 of these live presentations since November 2014, but the good news is that there's no end in sight, and we're going to continue doing these as long as we can into the future. So thank you all for being here today. I hope everyone had an excellent summer and holiday season. We took a little hiatus for a month as many of our members and partners are on vacations during July. So we hope that you too were able to soak up the sun and enjoy some relaxation time away from your business this summer. Our last presentation in June focused on stacking and combining skincare products and treatments to maximize your outcomes and patient satisfaction. And since then, we've added several new vendors, one of which fits perfectly into the skincare stacking protocols that were described during our June webinar, and they are here with me today, so I'm delighted to introduce them in just a moment. However, before we get started, I want to bring you all up to date with some of the most recent additions to our vendor partners. In the last 30 days, we added 5 new vendors, the first being Elusio, and for those of you that are surgeons, Elusio offers 3D augmented reality technology with real-time morphing animation. So what that means essentially is that it allows surgeons to show a prospective patient exactly what their breast augmentation or surgical treatment will look like on them. And you can customize it. It's an incredible conversion tool, and based on feedback from our members, it really helps to set up the right patient expectations during the consult. In July, we also partnered with SBA Loan Group. And for those of you who are looking for additional growth capital, whether it's to buy equipment or add personnel or add basic working capital or simply to expand, they can finance up to $1 million and provide incredible rates for our members. Another new partner who recently joined the network is the RN Specialist Corp. And our members in the Southwest here may be familiar with them. They have a huge client base out here in Southern California. And they actually offer a turnkey laser service. Which means that if you don't already offer laser services, but you'd like to provide those treatments without the upfront cost of a laser, they actually do it for you. So their nurses come into your practice, they do the laser treatments as frequently as you need, and you simply provide the patients in the treatment room. So it's a great option for some of our smaller members in the network. And finally, last week, we also launched one of our most competitive contracts ever through Cardinal Health. So through Cardinal now, our surgeons with an in-office operating room have access to aggregated ASC pricing, which basically means that you're going to receive the same pricing as a surgery center or a 10-man practice down the road on all of your surgical supplies. So we're really excited about the cost savings here. And I know you're all anxious to get into the presentation, so I'll introduce our guest speaker and partner who's here with us today. Probably the most exciting new vendor announcement we've made over the last month is our partnership with PCA Skin. And PCA Skin is the originator of advanced blended chemical peels, and they've been a leader in the development of professional treatments and consumer skincare products for the past 25 years, as many of you guys are already aware. And now PCA's cosmeceutical line and their peels are available to our MedResults members with a quarterly rebate, which is exciting. We love sending you guys rebate checks on a quarterly basis. And today we're excited to introduce Danae Marklin. She's here with us as she's their VP of Business Development. She's going to give us a high-level training on peels, and she's going to walk us through a recorded demonstration of a chemical peel treatment. So just before we begin, I want to remind you again that a 30-second survey is going to pop up with a few questions to capture your feedback after the end of this presentation. It's not a long survey. We do ask that you take 30 seconds to fill it out because if you have questions for Danae or you're interested in learning more about chemical peels or skincare treatments, or you simply have feedback for us, you can use the survey to let us know. So with that said, I'd like to introduce Danae Marklin of PCA Skincare.
Thank you so much, Jamie. I'm very excited to be here, and thank you, all of you out there, for taking the time to sign in for today's webinar. We're very excited about the new partnership with MedResults, and I'm very excited just to share some high-level information around the clinical and financial benefits of chemical peeling. As Jamie mentioned, we have been leaders within the chemical peel space since we started in 1990. I myself am a licensed esthetician and have been with PCA for about 13 years, so I hope you find the information that I have to bring today exciting and helpful for your practices. Now, this first slide, I just pulled out a few different quotes from several different journals and just speaking to why chemical peeling is very much so relevant right now, as well as a very time-tested and simple method of treatment. You're going to see dramatic results from these chemical peel agents. There's a ton of versatility as far as the acids that you have to choose from, and all in all, it's a very simple procedure to perform in most practices. It's also something that's standed the test of time very well. Chemical peels were in the peak of their popularity in the 1990s, and as lasers and new devices and new technology started to enter the industry, chemical peels kind of lost that exciting appeal. Now, within the last year or two, we've seen a dramatic increase in the number of peels being performed, as well as the consumer or the patient's interest in chemical peeling as a method of treatment for the skin. So we're at a very interesting time right now when it comes to chemical peeling within our aesthetic space. The first thing I'm going to jump into are just some various acids and the way that they interact with the skin, the types of percentages that you'll typically see, as well as indications for each. Now, most of you are probably very familiar with these at this point, but it's always good to just have a refresher or a review around the mechanism of action of these various acids, as then you're able to understand exactly how each will interact with the skin, and when combining acids together, you're able to get multiple benefits in one treatment. The first group of acids that we'll discuss are alpha hydroxy acids. Alpha hydroxy acids launched into the scene in the early 1990s with the introduction of glycolic acid as a topical treatment for cosmetic skin concerns. Soon after, lactic acid, malic acid, citric acid, as well as mandelic acid were introduced in typically lower percentages. Alpha hydroxy acids work by dissolving the intracellular bonds or desmosomes and that hold the skin cells together. So as you dissolve that glue that are holding the cells together, it allows for those cells to shed off in the days following. So during the treatment, you're actually dissolving the mortar within the brick wall, and afterward, within 3 to 5 days, the patient will actually start to see those skin cells flaking off of the surface. You're typically going to use percentages between 10 and 70% when using alpha hydroxy acids, and each will vary depending on the acid that you're using. For example, you might use a lower percentage glycolic acid to achieve similar results to a higher percentage lactic acid. So these percentage will vary depending on the acid that you're utilizing. From an indication standpoint, alpha hydroxy acids are typically a very superficial peeling agent, so they're staying within the epidermis, if not the stratum corneum exclusively. You can treat all Fitzpatrick's safely with alpha hydroxy acids, but you should always be careful with higher Fitzpatrick's, as inflammation can trigger that post-inflammatory hyperpigmentation response. Age control is a great candidate for alpha hydroxy acids. Exfoliation in general is going to help to smooth the appearance of the skin. And the application of all alpha hydroxy acids with percentages of 5% or more have been shown in studies to stimulate the production of collagen within the dermis. So there's often a misconception that you have to use very high percentages of acids and actually reach medium depth chemical peeling in order to affect or impact the dermis of the skin. And that's simply not true. An alpha hydroxy acid at very low levels can stimulate change in that dermal level, even though it's not interacting with it specifically. Hyperpigmentation is also a great skin condition to target with your alpha hydroxy acids. Hyperpigmentation, it needs to be lifted out of the skin. So the more exfoliation the skin is receiving, the faster that pigment is going to rise to the surface and be exfoliated out for a clear complexion. Acne, to reduce the impactions within the follicle that lead to the overproduction of bacteria and sebum production, so this is an excellent option for that. And then lower percentages of especially ingredients like lactic acid and citric acid are excellent for sensitive skin types. There's typically very little stimulation associated with those, and the lower percentages will give you a very light exfoliation without increasing inflammation in the skin. The next group of acids that we're going to discuss are beta-hydroxy acids, and really there's only one beta-hydroxy acid that we use in skincare currently, and that is salicylic acid. Salicylic acid works a little bit differently than an alpha-hydroxy acid in that it is more of a keratolytic agent. And so a keratolytic agent is going to dissolve keratin within the skin versus an alpha-hydroxy acid that would dissolve those desmosomal bonds. A keratolytic is going to dissolve the skin cells at the point of contact versus loosening them up for exfoliation in the days following. So typically with a salicylic acid treatment on its own, you're not going to see a lot of visible exfoliation post-treatment. Salicylic can be used from percentages typically of 10 up to 50%. I like to refer to the salicylic acid as being kind of, it's a tricky, mysterious type of acid, because when you apply salicylic, it is a very stimulating acid upon contact. And so the patient can really feel that tingling, stinging sensation upon application. However, salicylic acid is also inherently anti-inflammatory. So while it may feel like the acid is being very aggressive on the surface of the skin, it's actually decreasing inflammation throughout the treatment. And so you're getting an exfoliation, a reduction in inflammation, and that makes it great for all Fitzpatrick's, excellent for acne because salicylic acid is also a lipophilic molecule. So that means that it'll penetrate into the follicle itself and dissolve dirt, oil, and impactions on contact to keep those follicles clear. For rosacea, it's also a great option, especially for that subtype 2 papular-pustular rosacea. You're going to see, again, a reduction in the inflammation associated with that concern, as well as a reduction in the breakouts that might be associated there. And then last but not least is hyperpigmentation. Hyperpigmentation, as I mentioned earlier, is something that is sitting in various layers of the skin. So as we use a salicylic acid, remove the top surface layer, that hyperpigmentation will appear much lighter. Our next acids are probably the most commonly used, especially within the medical practice at this point, and that's trichloroacetic acid, or TCA. TCA is a chemical colorant, and it causes protein denaturation when you apply it to the skin. So essentially, it's going to dissolve those skin cells as well as encourage sloughing. And you can get a very superficial treatment with TCA, or you can get a medium depth full downtime treatment with TCA. So this is one of the more versatile acids that are available out there. Depending on the percentage you choose, the depth and the downtime and the results can vary greatly. You can, as you see, 6% TCA all the way up to a 50%, and then 65% plus is also used to spot treat certain areas of scarring and sebaceous hyperplasia in the physician's practice as well. TCA is an excellent acid for texture. Any type of textural concerns, TCA is going to be a great choice. TCA helps to smooth the surface of the skin, and so that means that it will smooth the ridge of a wrinkle, and it'll also help with any type of acne scarring, divots, anything like that that you have in the skin. A 6 to a 20% TCA is appropriate for Fitzpatrick's 1 through 6, while a 20 to a 50% TCA is typically recommended for no higher than a Fitzpatrick of 3, and that's because of the risk of the line of demarcation as well as post-inflammatory hyperpigmentation, and I'll speak about that a little bit more later. Age control, of course, because of the textural concerns there. You'll also be helping to create a significant amount of collagen when you're using an acid like TCA on the surface of the skin. Hyperpigmentation to dissolve that top layer of skin and help with those discolorations appearing more even, Actinic keratoses are also a great option for TCA. Many dermatologists will utilize TCA to help to treat those precancerous cells and hopefully prevent them from progressing. And then, as I mentioned earlier, any type of textural change, this is a great option. Okay, the last acid that we're going to discuss is a group of ingredients actually, and some are in the acid form, others are not, and those are retinoids. Retinoids, or vitamin A, are a very commonly used ingredient in skincare, very commonly used, of course, over the counter in daily care, as well as in the treatment room. The way retinoids work is they're going to reduce stratum corneum cohesion and increase cell turnover. So they work a little bit differently, as they are promoting cell turnover from the bottom up versus from a topical standpoint like our AHAs, BHAs, and trichloroacetic acid will work with the skin. By promoting healthy cell turnover, you're pushing new cells to the surface faster than they would in their natural cell progression. There's various percentage used and various forms of retinoids that are used. The bioavailable form of a retinoid or vitamin A is retinoic acid, and retinoic acid is what is used in tretinoin prescriptions. Retinoic acid is the only form of vitamin A that is bioavailable to the body. And so this is going to be the most potent form, but it's also the most irritating form. So there are some risks associated with that. There are certain professional treatments that offer a 0.3% retinoic acid as a booster or an add-on option to their professional peels. Another option is a higher percentage of retinol. Retinol is converted to retinoic acid in the skin, and because of that conversion process, you are not going to have as much surface irritation as you would with a retinoic acid. So you get the conversion, you get the retinoic acid you need within the skin, but you limit the amount of surface irritation that you might see with the more potent form. And then last but not least are retinoid esters. These are things like retinol acetate, retinol palmitate, and these are going to be far gentler on the skin because this is retinol combined with something else. And so in order for the skin to use it, it's going to have to separate itself from whatever is combined with that ester. It is then going to have to be converted into retinoic acid in the skin. So you're going to need to use higher percentages in order to get those results. All of these are great options. It really just depends on the type of patient that you're treating. I personally typically recommend either a retinol or a retinoid ester because you can get very comparable results without a lot of the risk of side effects and downtime. Indications for retinoids, really all Fitzpatrick's, and of course, all of your major skin concerns are going to benefit from retinoids. Retinoids, in addition to their exfoliation capabilities, are also going to help to stimulate collagen production for age control patients. They're going to help to reduce follicular impaction in your acne patients, and they're going to help to inhibit melanogenesis and break down melanin within the skin for hyperpigmentation. So really, every patient should be on a retinol on a daily basis, and retinol within the treatment room is a great way to really boost those effects. All right, now quickly I want to talk just about peel depth of penetration and what it really means in the grand scheme of things. I've mentioned it a couple times throughout the discussion of the various acids, but all peels really do create change regardless of the depth. So there is an interaction and an exchange of expression that takes place between the epidermis and the dermis. And so regardless of you reaching that dermal layer with your acid, you're still going to be stimulating change within that extracellular matrix. You'll be stimulating collagen production, hyaluronic acid and glycosaminoglycan production. But peels are all very different. And as I mentioned, there's a broad range of percentages out there. So the very superficial chemical peel is going to affect only the stratum corneum or the cornified layer of the skin. So it is just that outermost layer, typically between 17 and 22 layers, depending on the person. And that is going to induce very light flaking, if anything, visibly. The next depth is a superficial peel. A superficial peel stops at the basal layer of the epidermis. And so we are not breaking that basal layer. We are not penetrating at all into the dermis of the skin, and you will not see any visible blanching or frosting on the surface of the skin when you're performing a superficial chemical peel. Now, very superficial and superficial are going to typically encompass your alpha hydroxy acids, your retinol peels or retinoid peels. TCAs up to about 30% can still stay within that superficial epidermal layer. And then once you break that 30% mark, you will get more into that papillary dermis. And that is your medium depth. So as you reach the upper papillary dermis, you're going to start to see that frost on the surface of the skin. The amount of downtime and the amount of flaking that the patient is going to experience will be far more the deeper you go into the skin. And so this is an option for certain patients, but some people can't afford that downtime, so the superficial peels do come into play there. And then your deep chemical peels are not as widely used as they once were. Deep chemical peels would be things like your phenol peels, Baker's Gordon, as well as CO2 laser resurfacing and things like that can get into your upper reticular dermis. Now, just to go over some potential side effects as far as our deeper chemical peels are concerned, of course, there can be mild to severe discomfort with any application of acid. There's going to be some stimulation. The way that I describe chemical peeling is we're creating a controlled wound, and the depth of that wound is really up to the practitioner. If you create too much of a wound, then you'll often have things that you need to go back and fix or correct after the procedure is finished. If you can control that inflammation, you're able to create enough of a wound to where you're stimulating that wound healing response, that collagen deposition, that glycosaminoglycan deposition, but you're not doing too much to where you're creating future problems that you're going to have to go back and fix. So some mild discomfort is to be expected. Severe discomfort will typically come into play with your stronger and deeper acids. Erythema can be very transient and light, or it can be significant and can last for weeks, if not months, post-procedure, depending on the depth of treatment that you perform. Post-inflammatory hyperpigmentation. Any higher Fitzpatrick or anyone who's prone to hyperpigmentation to begin with has a propensity to overproduce melanin in the skin. And melanin is an inflammatory response. So the more aggressive we are with chemical peeling, the more at risk those specific patients are going to be to this post-inflammatory hyperpigmentation afterward. It's always a good idea to prep the patient's skin with hydroquinone, kojic acid, azelaic acid. These types of ingredients will help to control that melanogenesis process, and it will help to inhibit post-inflammatory hyperpigmentation coming up after the treatment. The line of demarcation I mentioned with TCA specifically, once you breach that basal layer where your melanocytes live, melanocytes are the cells that produce our pigment in the skin. Once you breach that basal layer where those pigment producing cells live, there's a chance that they're not going to come back. And so you may see the patient from time to time where their face is a different color than their neck and the rest of their body. And that's because the chemical peel itself has penetrated so deeply that that pigment simply is not going to come back in the same quality that it was before. Infection with deeper peels, anytime the skin is open, this is a risk. Renal or kidney failure, hepatotoxicity, of course with phenols only. And then side effects and complications are typically most associated with those higher percentages of straight acids. Superficial peels are a nice option because you get far less of the risk of side effects. And you're able to treat in a progressive rather than extremely aggressive approach. Now, progressive does not mean that these are wimpy acids or that you're not going to see any results with them. That simply means that we're going to get from point A to point B using very strategically selected ingredients that are proven to promote change within the skin versus just taking one really strong acid at a very high percentage and wiping out the complete playing field and starting over again. So progression simply means that we are producing change over a short period of time versus creating a giant wound and waiting for it to heal and starting over again. Decreased downtime, patients, especially nowadays, cannot always take a full week off work to heal from a medium depth chemical peel or a complete laser resurfacing. So these types of treatments can be performed even at lunchtime, and patients can go back to work, they can go back to their daily life, and they don't need to be negatively impacted by this experience. The reduction of those potential side effects that we just went through. Certain superficial chemical peels, a couple that we'll talk about today, combine ingredients like kojic and azelaic acid into those peeling agents so that way you're not only preventing the pigment from coming up prior to the treatment, but you're also doing it at the time of treatment. And then with superficial peels, you're going to have less stimulation associated with them. You'll have very consistent results, and you can opt to have another member of your staff actually perform those so that way you reserve your time as the physician for more important procedures that only you can perform. We as a company will come out and train every member of your staff on the benefits of the treatments, and we'll also make sure that each practitioner that might be applying those treatments knows how to do so in a very safe and results-oriented manner. Another great benefit of superficial chemical peels are the versatility. So with a lot of superficial peels, what you'll find is that they're going to be a variety of different acids. For example, combining TCA with lactic acid is a great way to get an alpha hydroxy acid exfoliation as well as a TCA chemical colorant exfoliation. Combining those two together give you a really great anti-aging peel concoction that will help to hydrate as well as exfoliate the skin. So by combining acids, we're able to treat multiple conditions at one time, and you're also able to treat all sensitivity levels and Fitzpatrick skin types with those superficial peels. This is just a visual depiction of what will take place during the peeling process with a superficial chemical peel. So within 5 days, you're going to see a series of peeling. Day 1, you see a little bit of redness and erythema in the skin. Day 2, you start to see the heaviest day of peeling, primarily in that perioral area. Days 3, you're starting to see that flaking lighten up a bit. And then by day 5, it's completely clear and her complexion looks nice and bright and smooth. Just some before and afters here. This is the PCA peel hydroquinone free. A patient received just one of those peels and then for 2 months used our pigment gel HQ free, which is a 3% kojic acid and 5% azelaic acid spot treatment, and then of course an SPF product during the day. The next patient received 5 of our Sensi Peel treatments, which is a 6% TCA and a 12% lactic acid. At home, she used a 2% hydroquinone, 3% kojic acid, and 5% azelaic acid spot treatment product, which is called our pigment gel. And then she also used a 0.5% encapsulated retinol product, our intensive clarity treatment. The intensive clarity treatment I'm going to talk about a little bit more later as far as its encapsulation technology, but this is a time-released retinol product that allows for less irritation on the surface and better results in the end as far as linking to better penetration. And then of course, all patients are on an SPF every day. The next patient is an anti-aging patient. We did 5 Ultra Peel 1 treatments on her, which were 10% TCA and 20% lactic acid. And then afterward, we applied a 10% retinol booster treatment. At home, she used a peptide serum that helps with the repetitive motion that leads to those expression lines. She was also on a 15% L-ascorbic acid product called C&E Strength, and then an anti-inflammatory moisturizer at night and an SPF during the day. Last patient that we'll look at received just one 20% TCA and 10% lactic acid peel. That's our Ultra Peel Forte. After 6 weeks at using our pigment gel at home, as well as the X-Linea, which is the acetohexapeptide 8 serum, and then a 20% C&E Strength Max or L-ascorbic acid topical, along with a sunscreen. Great results there. You can see not only a reduction in the fine lines, wrinkles, but also just an overall improvement of the skin tone and complexion, and a dramatic reduction in the amount of redness that was in her skin. All right, this is what we call our integrated skincare approach. And an integrated skincare approach just speaks to the fact that every patient starts with a consultation, typically. They will then go on to treatment. They will typically use something at home to repair their skin for the days immediately following that treatment. And then they're going to use some sort of regimen every day after that healing process is complete to maintain those results. So the cycle goes along, and then once you get them on that maintenance, in an ideal world, they're going to continue to come back to you for that treatment step, and the cycle continues. Now, the interesting thing here is that that treatment step is the variable step, and patients come in at different times depending on the treatment that you're providing. So here we've got laser as an example. So you have your laser patient. She's coming in, let's say, for laser hair reduction or collagen remodeling. So you're going to see that patient every 4 to 6 weeks, let's say. And at some point, their 6 treatments or series will be over with, and then they'll come back and see you maybe twice a year for maintenance. So there's not that repeat side of this all the time with laser. You're not necessarily going to see that patient every month for the rest of their life or every 6 weeks for the rest of their life. There does seem to be an end point with those types of procedures. Same thing goes with injectables. They're going to be repeat patients for you because they will come back and receive those treatments, but that's only every, 4 to 6 months? And so with other options within the practice, you're able to engage with that patient on a more frequent basis while not interfering with any of the other treatment options that they're already receiving. A chemical peel brings a patient back to your practice every 4 to 6 weeks, and it's something that you can encourage them to maintain throughout the rest of their life for healthy skin. And so this is something where you have an opportunity to engage with that patient on a more frequent basis than in some of the more invasive treatments that you're probably already offering. Now, the demand of chemical peels. I mentioned earlier that there has been a bit of a resurgence. And so this is the latest statistics from 2015 from the American Society of Aesthetic Plastic Surgery. 10.8 million minimally invasive procedures were done in 2015, and you can see the top 5 ranked here. Chemical peels came in at number 4, and the most unique thing about this to me is that chemical peels increased 25% from 2014 to 2015. Botox only increased about 15% from 2014 to 2015. So the growth that's taking place with those chemical peels is really impressive, and it really does go to show that people are talking about this again. There are lots of options out there, and the patient or consumer is becoming much more savvy when it comes to these types of treatments. All right, so getting down from a profitability standpoint. So this is just a very basic calculation that I put together. Many practices will be charging anywhere from about $100 all the way up to $300, depending on where you're located and where you're practicing. Here I put in a $150 mark just to be a little bit conservative with this. Now, when you perform a chemical peel with PCA, the materials are going to cost you about $5 to $10 depending on the treatment that you're performing. From a labor standpoint, if you've got an esthetician or a medical assistant on staff, we're looking at about $20 to $30 an hour is what we've used here as an approximation. So with those treatments, you're looking at a gross margin of $110 to $125 per peel. If you're able to produce up to 10 procedures per day, you're looking at up to $1,250 per day in profit, and your annual gross profit margin could be anywhere from $286,000 to $325,000 per year. So that's 10 patients per day. You, as the physician, may not even need to be involved as much with those individual procedures, and you're able to significantly increase the profitability of your practice. I included retail in here as well because I think that missing out on that retail opportunity, especially if a patient is there for a chemical peel or other professional treatment on their skin, those patients have invested. They're ready. They want what's best for their skin, and they trust you as the physician to give them the very best recommendations. And so many estheticians, physicians, caregivers in general are not necessarily comfortable with that selling portion or the retail sale portion of the patient visit. However, not doing so is just leading them to go somewhere else and try and find it on their own. So providing them with a solid recommendation that you believe in is a great way to really enhance that patient-physician relationship and make sure that they're a patient for life. Here we've got just a retail example of $160. Cost to you would be $80. Converting one patient per day who repurchases 3 times per year would get you over $75,000 a year in additional profit. All right, so 2 adopters per day, very simple model, combining in-office procedures with retail. And this is even applicable to very small practices. This is something that can be incorporated slowly. It can be incorporated full-fledged right at the very beginning. And a good partner will help you to see the benefits of the various ways to do this. I've seen practices who reserve 1 day a week for cosmetic procedures, and that's the day that they do their chemical peels. And that's when they schedule people so that they're not taking up time or anything else out of the practice or taking away from any other procedures. As you start to build demand, you can increase that to 2 a day, and then eventually you may have the need for that full-time esthetician. So this is something that can grow as the practice grows, or it can be implemented into a very high volume practice immediately. And then last but not least, we can always talk about profit, but the bottom line is that if you're promoting something you believe in and you are suggesting products that are going to be beneficial for your patient base, then that is an ethical recommendation. That is something that you can feel confident in as a physician, and at the same time make sure that you are happy with your bottom line. So surgical and non-surgical in-office procedures alone, without any daily care or chemical peel treatments, are going to often tighten the appearance of the skin. They will help to build volume and things like that, but they're not necessarily going to improve the texture and the quality of the skin itself. They're not necessarily going to target hyperpigmentation or acne or rosacea. So you are getting some results, but not the best. Daily care alone, without professional treatments, you'll see some changes in the skin, but you're not going to see those dramatic results that we know all patients want. And then the combination of the two is really where you're going to see maximum patient results and maximum profitability from your standpoint. So the magic combination is pro treatments with daily care regimens that equals visible patient results, and ultimately what that means is that patient will be loyal, they'll trust you, they'll come back repeatedly, they'll recommend you to their friends, and that means that you will have a more successful practice. So that is my presentation portion of today. I hope that it was helpful and you took a little bit of tidbits away from it. The next piece that I'm going to do is actually show a video of a demonstration of someone receiving our PCA peel with hydroquinone. And the intention of this video is simply to show you how simple the application can be, as well as how comfortable and how nice the skin looks after the treatment itself. So we will go ahead and get started here. And I should preface this that this video looks great on my screen when I play it. However, depending on how many things you have open on your own personal computer and other things could come into play. So if it's not of best quality, I do apologize, but I am going to speak through every step. And you can also follow up afterward if you'd like to have a copy of the video yourself. All right, so this is Danielle Racile. Danielle is a licensed esthetician, and she is going to be performing our treatment today on Amanda. Amanda has very resilient skin. We chose the PCA peel with hydroquinone for her. And the first step of any protocol is to cleanse the skin. So Danielle has moistened the skin with water at this point, and now she's going to do a hand cleanse with our facial wash oily problem. We choose the facial wash oily problem for every patient because this is the starting point of your degreasing process. So facial wash oily problem is a gel cleanser that's pH balanced. It contains lactic acid as well as gluconolactone. And that's going to help to dissolve sebum in the skin and help to make sure that that peel solution is going to penetrate as evenly and deeply as possible. Danielle is utilizing a traditional hand cleanse method. It is fine to also cleanse the skin with cotton squares or sponges. Many dermatology and plastic surgery practices actually give the bottle of facial wash oily problem to the patient and say, go wash your face for me, and then they come back and apply the peel themselves. So there are many ways that you can cleanse the skin. The most important thing is simply to make sure that the skin is very clean prior to applying that peel itself. So Danielle is removing all of the cleanser at this point and making sure that there's no residue. Any film or anything like that will impede the penetration of the acid. So the main goal is to have a very clean, dry surface for that acid to then be applied to. Now as she's finishing up here, she's going to move on to step 2. And step 2 is the actual degreasing process. Step 2, we recommend using our smoothing toner. And many times with chemical peels, physicians might be used to using acetone or alcohol as the degreasing agent. And that has been used for many, many years at this point in the protocol. The reason that we recommend the smoothing toner instead is because acetone and alcohol can really impact the barrier function of the skin. So you're not only removing sebum with alcohol and acetone, you're also removing important and crucial lipids and ceramides. And so with the smoothing toner, you are removing that oil and you are also ensuring that the barrier is intact. Now, at this point, Danielle asked Amanda, on a scale of 1 to 10, 10 being very uncomfortable, where are you at in the process? She said a 2. Now, some patients are going to experience a lot more stimulation with this product. Others will experience a lot less. This is your sensitivity gauge. So at this point, she's attested at a 2, and she's now going to apply our PCA peel with hydroquinone. Now, you'll notice she does 5 circles on a cotton 4x4. That allows for enough product to cover the entire face in one even layer. She's going to start on the forehead. The forehead skin is typically a little bit thicker and more resilient than the rest of the face. The next is she will apply in panels all the way up either side. And then she's going to apply it to the nose and finish with the upper lip. Now, these cotton 4x4s that Danielle is using are important to the protocol because they're very tightly woven, they're very soft. So there is no abrasion going on with this, and it also allows for a very small amount of product to be used so that way you're not wasting anything by pouring something into a dish and then painting it on with a brush, so on and so forth. Danielle's now asked again on a scale of 1 to 10, 10 being very uncomfortable, where are you at? And Amanda has replied with a 2. So Danielle is fanning her at this point, and the amount of time in between layers really varies from patient to patient. But what you want to confirm is that they're not coming up from that initial number. So Danielle stopped fanning. She asked Amanda again on a scale of 1 to 10, where are you at? And she said she's at about a 1. So at this point, Danielle's confident that Amanda's skin is coming back down, and she's going to wait a couple more seconds here and fan and just make sure everything's dry before she proceeds with an additional layer. Now, the PCA peel is one of our modified and enhanced Jesner solutions. It's a 14% lactic acid, 14% salicylic acid, and then there's 2% hydroquinone and 3% kojic acid in that product. This can be done in up to 6 layers. A 6-layer treatment would obviously produce a lot of flaking in the skin and would potentially create just a small amount of downtime for the patient. However, 6 layers would be something that most practices would build up to and wouldn't necessarily start with right off the gate. Amanda is now receiving her second layer, and with each layer, it's very typical for the amount of stimulation to increase. It doesn't always happen, but if it does, that simply means that the peel itself is penetrating deeper into the skin with each layer, and that is to be expected. So now that she's applied her second layer, she's going to ask again on a scale of 1 to 10. You'll notice she doesn't start fanning until the patient has responded. And then the end point for any of our chemical peels that we recommend is if a patient replies a 6 or above on the scale of 1 to 10, that would mean that they're starting to experience significant inflammation in the skin, and so we recommend stopping at that point. So Danielle's going to fan for just a couple more minutes, check one more time on her. She's visually inspecting the skin because that 1 to 10 scale doesn't always work. Patients know why we're asking. They know what we're up to, and so you're always going to have the more is better patient, and if you ask her where she's at on a scale of 1 to 10, she might respond with a 1. Meanwhile, her face is beet red and she's hanging onto the side of the bed for dear life because you can tell she's in pain. So don't only rely on what the patient's telling you, also make sure that you are taking a look at how the skin's responding visually on your end. Now you can see that Amanda's got a little bit of erythema coming up in her nasolabial folds. That's very common considering that area of the skin is typically a little bit more sensitive than the rest. But all in all, there's not a lot of blotchiness, there's not a lot of redness at all. All right, so Danielle's decided to stop at 2 layers with Amanda today. And now's our opportunity to really flood the skin with beneficial ingredients. This is something that makes PCA protocols a little bit different than most of those peel protocols out there. This is the rejuvenating serum that Danielle's applying. It's an epidermal growth factor product that's combined with various antioxidants. And while the pH of the skin is nice and low because of the peel, that rejuvenating serum and all of those beneficial ingredients are going to penetrate even deeper into the skin. The next product Danielle's applying is our C&E strength. So this is a 15% L-ascorbic acid with a 5% pure tocopherol. Those ingredients are encapsulated in a silicone wrap. So this product doesn't have any water in it. It does not turn brown, and it does not oxidize the way that most vitamin C products will on the market. It's an incredibly unique option. All patients can benefit from vitamin C, so these are very common topicals to apply in one of our protocols. Now, the last thing that Danielle is going to apply full face as far as corrective products are concerned is our intensive brightening treatment. Intensive brightening treatment is a 0.5% retinol encapsulated in an omnisome delivery technology. That omnisome is something that actually peels back like an onion over a 10-hour period and allows for that retinol to be evenly dispersed throughout the epidermis. So you're getting less surface irritation upon application, but deeper penetration of that beneficial ingredient. But we didn't just stop there with the brightening product. It's got the retinol. It's also got 4% niacinamide. There's phenylexylresorcinol in there, and there is also resveratrol in that product. So you are getting an awesome combination of lightening agents and melanogenesis inhibition in one product. And last but not least is an eye product. Every patient can benefit from an eye product. This is our Ideal Complex Revitalizing Eye Gel. This utilizes 6 different peptides to help to stimulate collagen production, decrease puffiness, and also to increase circulation to decrease dark circles. It also has a botanical extract in there that helps to lift the eyelid skin, which is something that's really unique. All right, now that Danielle is done customizing her protocol, she's going to finish it with Rebalance, which is a calming cream with evening primrose seed oil, as well as aloe vera to help to restore the pH of the skin and calm any inflammation that might still be present. The Rebalance is something that we also recommend at home for normal to oily patients and anyone with rosacea. That evening primrose seed oil acts as a vasoconstrictor, so it'll help to instantly reduce redness in the skin. Now, the last thing that Danielle's putting on within the protocol is the Hydrator Plus SPF 30. Hydrator Plus is a moisturizer plus SPF. It is a zinc oxide combined with octinoxate and octosalate. The combination of that physical and chemical sunscreen actually gives us the broadest coverage from the sun as we can get here in the United States according to the FDA-approved sunscreen agents. So this is an excellent option for normal to drier skin or patients in the winter months when the weather might be a little bit drier. It's very light, and it's good for those patients that don't want to have to apply a moisturizer and then a sunscreen as well. It's a nice one-stop shop. Thank you so much, Danielle, for that beautiful demonstration. And that really concludes my presentation for today. So I hope you guys enjoyed it, and I will turn it over to Jamie.
Thank you so much, Danae. We really appreciate your presentation. It was extremely detailed. I know there was a lot of information that was covered today, which we're grateful for. But if anyone would like additional information, as I mentioned before, you can simply let us know in the brief survey that's going to pop up once we close down the presentation. If you have questions for Danae, she is going to answer them directly, and you're going to have to use the survey again, as I mentioned, to ask those questions. Danae, that was excellent. I think the key takeaway for everyone is really just to remember that the combination of those professional treatments and skincare can really help you to maximize your patient's results. So as I mentioned at the beginning of the presentation, one more thing for those of you that maybe are using PCA's peels, skincare, and you're a MedResults member, you're now eligible for their quarterly rebate program, and the end of the quarter is September 30th. So get your orders in. And if you're not using their peels and you're interested in learning a little bit more about it, certainly get in contact with us and we'll give you more information. So with that said, I just want to thank everybody for attending today. Thank you so much, and we look forward to seeing you at our next webinar on August 25th. So mark your calendars. You can go to our website to register there, and we look forward to seeing you then. Thank you, and have a great afternoon.